Ultimate Mental Health Suicide Prevention Practice Guide. Question 1. An individual who has survived incest and is receiving treatment at the mental health clinic feels relief upon understanding that her anxiety and depression are: Option A, going to be eradicated with treatment. Option B, normal and will soon pass. Option C, abnormal but will pass. Option D, a normal reaction to post-traumatic events. The correct answer is option D, a normal reaction to post-traumatic events. It is important to recognize that anxiety and depression are common responses to traumatic events like incest. Understanding that these feelings are normal reactions can help validate the individual's experiences and. Question 2. A patient with schizophrenia is prescribed risperidone. The nurse should monitor the patient for which common side effect of this medication? Option A, granulocytosis. Option B, weight gain. Option C, hair loss. Option D, hyperthyroidism. The correct answer is option B, weight gain. When a patient is prescribed risperidone, an atypical antipsychotic, the nurse should monitor for weight gain as it is a common side effect of this medication. Weight gain can occur due to metabolic changes and. Question 3. A patient with bipolar disorder has been prescribed lithium. Which dietary advice is important for the nurse to include? Option A, avoid foods high in tyramine. Option B, maintain a consistent salt intake. Option C, increase protein intake. Option D, avoid foods high in fat. The correct answer is option B, maintain a consistent salt intake. Patients prescribed lithium should maintain a consistent salt intake to prevent fluctuations in lithium levels. Salt intake can impact lithium levels, and sudden changes in salt intake can affect how the body absorbs. Question 4. A healthcare provider is providing care for a patient with schizophrenia. Which symptom would be considered a positive symptom of this disorder? Option A, eulogia. Option B, ondonia. Option C, delusions. Option D, flat affect. The correct answer is option C, delusions. Delusions are considered a positive symptom of schizophrenia. Positive symptoms represent an excess or distortion of normal functions, such as hallucinations, delusions, or disorganized speech or behavior. N. Question 5. For a patient with obsessive-compulsive disorder (OCD) who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A, exposure and response prevention. Option B, dialectical behavior therapy. Option C, family therapy. Option D, interpersonal therapy. The correct answer is option A, exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 6. Which factors tend to increase the difficulty of diagnosing young children who demonstrate behaviors associated with mental illness? Select one that does not apply. Option A, limited language skills. Option B, level of cognitive development. Option C, level of emotional development. Option D, parental denial that a problem exists. The correct answer is option D, parental denial that a problem exists. Diagnosing mental illness in young children can be complex due to their limited language skills, cognitive development, and emotional development. However, parental denial does not directly affect the child's. Question 7. Which statement made by the patient demonstrates an understanding of the effective use of newly prescribed lithium to manage bipolar mania? Select one that doesn't apply. Option A. I remind myself to consistently drink 6 12-ounce glasses of fluid every day. Option B. I discussed the diuretic prescribed by my cardiologist with my psychiatric care provider. Option C. Lithium may help me lose the few extra pounds I tend to carry around. Option D. I take my lithium on an empty stomach to help with absorption. The correct answer is option C. Lithium may help me lose the few extra pounds I tend to carry around. Rationale. Question 8. When assessing a patient with major depressive disorder, which symptom would most likely be observed? Option A, euphoria. Option B, ondonia. Option C, increased energy. Option D, racing thoughts. The correct answer is option B, ondonia. Ondonia, the inability to feel pleasure in activities that were once enjoyable, is a hallmark symptom of major depressive disorder. Patients with major depressive disorder often experience a pervasive feeling of. Question 9. In treating a patient with generalized anxiety disorder, GAD, using cognitive behavioral therapy, CBT, what is the most appropriate goal of this therapy? Option A. To explore the patient's childhood experiences. Option B. To reduce the patient's symptoms through medication. Option C. To change the patient's negative thought patterns. Option D. To improve the patient's social skills. The correct answer is option C. To change the patient's negative thought patterns. The most appropriate goal of cognitive behavioral therapy (CBT) in treating generalized anxiety disorder (GAD) is to change the patient's negative thought patterns. This therapy focuses on identifying and modifying. Question 10. Which of the following is a negative symptom of schizophrenia? Option A. Hallucinations. Option B. Delusions. Option C. Alogia. Option D. Paranoia. The correct answer is option C. Alogia. Alogia, also known as poverty of speech, is a negative symptom of schizophrenia. It refers to a reduction in the amount of speech or the feeling that one has nothing to say. Hallucinations and delusions are positive. Question 11. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client. She is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as option A. Moderate, option B. Severe, option C. Mild, option D. Non-existent. The correct answer is option B. Severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in. Question 12. Which medication is typically prescribed for the treatment of attention deficit/hyperactivity disorder (ADHD? Option A. Haloperidol. Option B. Sertraline. Option C. Methylphenidate. Option D. Clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant often prescribed to manage symptoms of ADHD. It works by increasing the activity of certain neurotransmitters in the brain, helping to improve focus, attention. Question 13. Which mood stabilizer is commonly prescribed for bipolar disorder? Option A. Sertraline. Option B. Lithium. Option C. Clozapine. Option D. Haloperidol. The correct answer is option B. Lithium. Lithium is a well-established mood stabilizer commonly prescribed for the treatment of bipolar disorder. It helps to control manic episodes, stabilize mood swings, and reduce the risk of relapse in individuals with. Question 14. In treating social anxiety disorder, which medication is commonly prescribed to patients with this condition? Option A. Methylphenidate. Option B. Sertraline. Option C. Lithium. Option D. Haloperidol. The correct answer is option B. Sertraline. Sertraline is a selective serotonin reuptake inhibitor (SSRI) commonly used to treat social anxiety disorder. SSRIs are a first-line pharmacological treatment for social anxiety disorder due to their effectiveness in. Question 15. April, a 10-year-old admitted to inpatient pediatric care, has been getting more and more wound up and is losing self-control in the day room. Timeout does not appear to be an effective tool for April to engage in self-reflection. April's mother admits to putting her in timeout up to 20 times a day. The nurse recognizes that. Option A. Timeout is an important part of April's baseline discipline. Option B. Timeout is no longer an effective therapeutic measure. Option C. April enjoys timeout and acts out to get some alone time. Option D. Timeout will need to be replaced with seclusion and restraint. The correct answer is option B. Timeout is no longer an effective therapeutic measure. The correct choice is B because the scenario clearly demonstrates that timeout has lost its intended therapeutic effect for April. The key indicators are her increasing agitation and loss of self-control in the day. Question 16. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? Option A. A new psychiatrist is a chance to start fresh, I'm sure it will go well for you. Option B. You say you look forward to the meeting, but you appear anxious or unhappy. Option C. I noticed that you frowned and avoided eye contact just now. Don't you feel well? Option D. I get the impression you don't really want to see your psychiatrist, can you tell me why? The correct answer is option B. You say you look forward to the meeting, but you appear anxious or unhappy. Choice B is the most therapeutic response as it acknowledges the discrepancy between the patient's verbal statement and nonverbal cues. By addressing both the patient's expressed anticipation and the conflicting. Question 17. Which therapeutic approach is most effective for managing borderline personality disorder? Option A, dialectical behavior therapy. Option B, cognitive behavioral therapy. Option C, psychoanalysis. Option D, supportive therapy. The correct answer is option A, dialectical behavior therapy. Dialectical behavior therapy (DBT) is considered the most effective therapeutic approach for managing borderline personality disorder. DBT is a specialized form of cognitive behavioral therapy that focuses on Question 18. Substance abuse is often present in individuals diagnosed with bipolar disorder. Laura, a 28-year-old with a bipolar disorder diagnosis, chooses to drink alcohol instead of taking her prescribed medications. The nurse caring for this patient recognizes that Option A, anxiety may be present. Option B, alcohol ingestion is a form of self-medication. Option C, the patient is lacking a sufficient number of neurotransmitters. Option D, the patient is using alcohol as a coping mechanism. The correct answer is option B, alcohol ingestion is a form of self-medication. Individuals with bipolar disorder may turn to alcohol as a form of self-medication to cope with their symptoms. This behavior is often seen as an attempt to manage mood swings and alleviate distress. It is important. Question 19. In addition to anti-anxiety agents, which classification of drugs is commonly prescribed to treat anxiety and anxiety disorders? Option A, antipsychotics. Option B, mood stabilizers. Option C, antidepressants. Option D, cholinesterase inhibitors. The correct answer is option C, antidepressants. Antidepressants, especially selective serotonin reuptake inhibitors (SSRIs) and serotonin norepinephrine reuptake inhibitors (SNRIs), are frequently used in the treatment of anxiety disorders. These medications help. Question 20. Which statement demonstrates a well-structured attempt at limit setting? Option A, hitting me when you are angry is unacceptable. Option B, I expect you to behave yourself during dinner. Option C, come here, right now. Option D, good boys don't bite. The correct answer is option A, hitting me when you are angry is unacceptable. Choice A, hitting me when you are angry is unacceptable, demonstrates a well-structured attempt at limit setting because it clearly defines the unacceptable behavior without ambiguity. This statement sets a clear. Question 21. The school nurse has been alerted to the fact that an 8-year-old boy routinely play acts as a police officer, locking up other children on the playground to the point where the children get scared. The nurse recognizes that this behavior is most likely an indication of Option A, the need to dominate others. Option B, inventing traumatic events. Option C, a need to develop close relationships. Option D, a potential symptom of traumatization. The correct answer is option D, a potential symptom of traumatization. The behavior of an 8-year-old boy play acting as a police officer and locking up other children to the point of scaring them is likely a symptom of traumatization. Children may reenact traumatic experiences through. Question 22. Which activity is most appropriate for a child with ADHD? Option A, reading an adventure novel. Option B, Monopoly. Option C, checkers. Option D, tennis. The correct answer is option D, tennis. Children with ADHD often struggle with sustained attention, impulsivity, and hyperactivity, making it essential to select activities that align with their neurological needs while minimizing frustration. Tennis D. Question 23. The mental health team is determining treatment options for a male patient experiencing psychotic symptoms. Which question shouldn't the team answer to determine whether a community outpatient or inpatient setting is most appropriate? Option A. Is the patient expressing suicidal thoughts? Option B. Does the patient have intact judgment and insight into his situation? Option C. Does the patient have experiences with either community or inpatient mental health care facilities? Option D. Does the patient require a therapeutic environment to support the management of psychotic symptoms? The correct answer is option C. Does the patient have experiences with either community or inpatient mental health care facilities? Assessing suicidal thoughts, judgment, insight, and the need for a therapeutic environment are crucial factors in determining the appropriate treatment setting for a patient experiencing psychotic symptoms. Past. Question 24. Which medication is commonly prescribed for the treatment of panic disorder? Option A, haloperidol. Option B, clonazepam. Option C, lithium. Option D, fluoxetine. The correct answer is option B, clonazepam. Clonazepam, a benzodiazepine, is commonly prescribed for the treatment of panic disorder due to its anxiolytic properties. It helps reduce the frequency and intensity of panic attacks by acting on the central nervous. Question 25. Therapeutic communication is the foundation of a patient-centered interview. Which of the following techniques is not considered therapeutic? Option A, restating. Option B, encouraging description of perception. Option C, summarizing. Option D, asking why questions. The correct answer is option D, asking why questions. Asking why questions is not considered a therapeutic technique in patient-centered communication, as it can make patients feel defensive or judged. Why questions may imply criticism or put the patient on the spot.